Hello everyone, and thanks for tuning in. And guys, on today I'm back with the mental health moments. And guys, let's not forget, May is Mental Health Awareness. So guys, on today I will be talking about who is at risk for developing mental disorders. So one thing I want to let you know, guys, I'm not a doctor, I'm not a nurse. I'm just a young lady that comes in and talk about the mental health piece. And the reason why I talk about it so much is because in our communities, we do not have a lot of people talking about it. And sometimes in our communities, we don't believe in mental health disorders. So that's why I come on to talk about it and share information that may help you or someone you know or a loved one. So guys, on today, I just want to say who is at risk for developing a mental disorder. At any one time, a diverse set of individuals, family, community, and structural factors may combine to protect or undermine mental health, although most people are resilient. People who are exposed to adverse circumstances, including poverty, violence, disability, and inequality, are at higher risk. Protective and risk factors include the individual psychological and biological factors, such as emotional skills, as well as genetics. Many of the risk and protective factors are influenced through changes in brain structure and or function. And then I'm going to talk about health system and social support. Health systems have not yet adequately responded to the needs of people with mental disorders and are significantly under-resourced. The gap between the need of treatment and its provision is wide all over the world and is often poor in quality when delivered. For example, only 29% of people with psychosis and only 1/3 of people with depression receive formal mental care. People with mental disorders also require social support, including support in developing and maintaining personal, family, and social relationships. People with mental disorders may also need support for educational programs, employment, housing, and participation in other meaningful activities. Some of the disorders are factitious disorders. Factitious disorders are a condition in which a person knowingly, intentionally creates and complains of physical and or emotional symptoms in order to place the individual in the role of a patient or a person in need. Somatic system disorder is where a person with a somatic system disorder, formerly known as psychosomatic disorder or somatoform disorder, they experience physical symptoms of an illness or of a pain which is excessive and disproportionate levels of distress, regardless of whether or not a doctor can find a medical cause for the symptom. Another disorder is called tic disorder. People with tic disorder may make sounds or display non-purposeful body movement that are repeated quickly, suddenly, and are uncontrollable. Sounds that are made involuntary are called vocal tics. And then there's Tourette's syndrome, and it is an example of a tic disorder. Other diseases or conditions, including various sleep-related problems, are forms of dementia, including Alzheimer's disease, and sometimes classified as mental illness because they involve the brain. Other disorders related are brain. Other disorders are OCD, which is obsessive compulsive disorder. People with OCD are plagued by constant thoughts or fears that cause them to perform certain rituals or routines. The disturbing thoughts are called obsessions, and the rituals are called compulsion. An example is a person with an unreasonable fear of germs who constantly wash their hands. Another one is called post-traumatic stress disorder, and that's one we hear about a lot. PTSD is a condition that can develop following a traumatic or a terrifying event, such as sexual or physical assault, the unexpected death of a loved one, or natural disaster. People with PTSD often have lasting and frightening thoughts and memories of events and tend to be emotionally numb. Another less common type of mental illness include stress response syndrome, which is formerly called adjustment disorder. Stress response syndrome occurs when a person develops emotional or behavioral symptoms in response to a stressful event or situation. The stressors may include natural disaster, such as an earthquake or a tornado, events of crisis, such as a car accident or a diagnosis of a major illness or interpersonal problem, such as a divorce, death of a loved one, loss of a job, or a problem with substance abuse. Stress response syndrome usually begins within 3 months of the event or situation and ends within 6 months after the stressors are eliminated. This is another disorder, is called dissociative disorder. People with dissociative disorder suffer severe disturbance or changes in memory, consciousness, identity, general awareness of themselves and their surroundings. This disorder usually are associated with overwhelming stress, which may be the result of a traumatic event, accident, disasters that may be experienced or witnessed. And then witnessed by the anxiety or panic, such as a rapid heartbeat and sweating. An anxiety disorder is diagnosed if the person's response is not appropriate for the situation. If the person cannot control the response, or if the anxiety interferes with normal function. Anxiety disorders include generalized anxiety disorder, panic disorder, social anxiety disorder, and specific phobias. The next one I'm going to talk about is a mood disorder. These disorders are called affective disorders, involve persistent feelings of sadness or periods of feeling overly happy, or fluctuations from extreme happiness to extreme sadness. The most common mood disorders are depression, bipolar disorder, and bipolar disorder. Psychotic disorder or psychotic disorders involve distorted awareness and thinking. Two of the most common symptoms of psychotic disorders are hallucination, the experience of images or sounds that are not real, such as hearing voices, and delusions, which are false fixed beliefs that the ill person accepts as true, despite evidence to the contrary. Schizophrenia is an example of a psychotic disorder. And the last one we're going to talk about is eating disorders. Eating disorders involve extreme emotion, attitudes, and behaviors involving weight and food. Anorexia nervosa, bulimia nervosa, and binge eating disorders are the most common eating disorders. So guys, I just wanted to go over some of the disorders and remind you guys that mental illness is real. There are people dealing with different types of mental illness. That's why I try to come on and talk about the different types of mental disorders. So if you know someone that may be having some of the symptoms, you may be able to go ahead and guide them to get the help that they need. The most important thing is getting a diagnosis and knowing what's happening with you if you have a mental illness. It's very important. And it's very important that we are checking on our loved ones, checking on our friends, and checking on our neighbors to make sure that they are not having some issues that we may be able to see and get them help. The main thing, guys, is to get your diagnosis and get the help you need. Everything does not mean you have to take a medication. A lot of people don't take medication, they go see a therapist, and that's how they get the help. But if you need the medications, it's best to do whatever the psychiatrist or the therapist or someone like that guides you to do, and you'll know what's best for you. But the reason why I come on is just to talk about it and let you know mental health is real. A lot of people have a lot of issues that they really don't talk about. So if we notice some things, maybe we might be the one that can go ahead and talk to them and get the help that they need. So guys, I am not going to stay on much longer. I just like to come on and talk to you about the different types of mental illnesses, so that if you can see some of the things in someone, you might be able to help them. So guys, I hope you guys are having a great Monday. And I just want to say thank you to all my subscribers for subscribing to the channel, guys. And I thank you for all the new ones, guys. You guys rock. I thank you for coming to the channel and checking me out. And make sure, guys, you are having a happy Monday. And don't forget to take some time out to love on yourself. Take some time out for your mental health. Each day we should be doing that. So guys, have a great one. And thanks for coming to the channel. I really appreciate you.